Anyway, so like I said, the payer systems are broken, and we're not going to be able to raise rates out of this to be the silver bullet to solve this problem. We as folks that run the EMS system, we need to reduce the barriers to entry to getting into the EMS system and staying in there. And I'll talk about that and keeping those folks in there. I'll talk about that here in a second. Ease of use of the West Virginia State EMS system. So the certification and licensure system interacting with the state office. I think you all have taken a big step of getting someone in that role, that lead role, which is a fantastic thing. But also the communications back and forth with the state office, keeping those standards easy to use and easy for folks to navigate will be a big piece of that. And I think that overall, that all of us have to start thinking about the systems of care. So I know a lot of times in West Virginia, I'm born and raised here, but there was I think sometimes we think that those imaginary county lines are there's huge walls there, and I think sometimes we have to think past those and think about how can we work together or work innovatively to solve some of the problems that we have around the state, and even sometimes outside of West Virginia, if things make sense. Back on my original point, no matter how efficient I get an EMS system, there's always going to be a readiness cost. Delegate Statler's area right now in West Virginia, or in that area of Mon County, right now that in the last about year, it averages 0.8 to 1.2 calls per day. So if we're looking at the actual payer model, reimbursed a few $100s for every call that we would go on, you can see right now that there's not necessarily going to be a real viable option or an economic model that makes sense for us to have an ambulance in the western part of the county. Yet, I live in this county. I want our people covered. Delegate Statler wants his people covered. So there's always going to be a cost of readiness to make sure that we have those resources available. The public expects that we have an ambulance arrive in a reasonable time, that you had educated and trained professionals, whether that is volunteer or career. If you're still lucky enough to have a good volunteer cadre and a good volunteer agency, I implore you, to your constituents and to your local politicians and local leaders, that if they need some money for an ambulance or need money for a station or need money for equipment, for goodness sakes, please give it to them. Because as you know, as soon as you move over to that career agency, it gets really expensive. And if you've got a dedicated group of folks that are leaning into that, absolutely give them the resources that you can afford. And then obviously they want high quality treatment and timely transport to a hospital. This data is a couple years old, and some of those changes, some of those colors may have changed with recent elections, but 60% of counties in West Virginia provide some sort of EMS funding, be it a levy or tax or whatever else. Of the counties that support EMS, I like to use a per capita model, because I think that levels out the more populous counties versus the more rural counties. Of those that do that, as far as the per capita cost, anywhere from 22 cents per person up to 221, with the statewide average hitting around $47 a person. So you're like, Forrest, why is this important? Why do I care about this? So I start looking at other larger models around the U.S. for county-based EMS services. And I'm using a county-based model just as a point, a talking point, because we are very familiar with the county-based services or county-based thinking in West Virginia. So if you look at like the Lee County, Florida, or the Travis County, Texas, or St. Charles County, Missouri, you look at their per capita costs, they're all hitting somewhere in that $40, $50, $60, $70, $80 range per capita. So when we start thinking about what does it cost to provide EMS service for the county, we've got a little bit of a benchmark to try to see like where do we need to get to, right? Because that's always the answer, like how much or where do we need to fund this to? So a couple pieces. One, the PEIAs and the state Medicaids and the payers that you all have the ability to raise the rates on for EMS reimbursement absolutely is the right thing to do. Like I said a minute ago, that's not the only answer. Just doing that's not going to solve the problem. There's still going to be a readiness cost to this. I think there's a little bit of a model like if you think of a retail model, we get more people in the door, we sell more stuff. That's going to solve our problem, right? EMS doesn't work that way because you want us to be available, just like your other public safety, like our public safety partners. Remember that other than just a few small examples, EMS has to actually take you somewhere to get reimbursed for that service. So we can't necessarily get paid for services that we just show up, you know, if we reverse an overdose or we work a cardiac arrest at your house or something to that effect, those costs all just get absorbed by the EMS agency. We're not necessarily compensated for readiness refusals or cancellations. So I wanted to dig in real quick here because I think this is an important slide of understanding the EMS billing piece. So one part of this, and this is using a bill that I pulled randomly, and then we ran it through a couple different models of a $940.99 trip that EMS that was a call for Mon EMS. If that was a self-insured patient, that whole red bar, I like to work right to left on here. That whole red bar would all be the patient's responsibility. If those of us that are lucky enough to have a commercial insurance, PEIAs or Blue Cross Blue Shield, et cetera, those folks would pay the insurance would pay the $762, and the patient, the copay that you all pay, the $20, $40, $60. In this model, I think it's $178. So then you move over to our government payers, which are the Medicaid and Medicares. They get the same bill because we have to bill everybody the same. I can't bill different rates because that's not the right thing to do. So Medicaid pays their payment, and then we see that yellow bar at the bottom, and I'll come back to that. Hop over to the Medicare payment. Medicare pays their couple $100. The patient gets their small copay. Now that yellow bar, that's really important because because we play in the government system, we can't go after the patient for that additional amount. So what the government says is, Dear Forest, thank you for taking care of our patient. We appreciate it. Here's our $285 payment. This bill is now paid in full, and you're done with the rest of that. So it's if you think about that, majority of our folks are above 65 or in the Medicare system. That's a huge piece of the federal payers. So we can't volume solve our problem out of this. So to that point, the payers that you can control do that. We start talking about readiness. I think that one of the pieces of that is, I know you all have empowered the counties to do some things, and I do think that we got to be careful not to penalize any of the counties that are already supporting EMS in some fashion. However, I think that you as the legislature have to figure out ways to incentivize counties to continue to do the right thing, whether that be a match program somehow, and get them to find ways to partner with the state to fund EMS service to ensure that there is a readiness. Encourage collaboration and regionalization. So if things make sense, I know sometimes that we all like to make sure that the patch on the side of the truck is my little town or my little community, but sometimes we have to think bigger scale, and maybe the delivery of services is in more of a regionalized model or more of a collective model. This one I think is a really easy one, is that the certification costs to become an EMS provider in West Virginia are not terribly cumbersome. I think all in they're about $250 per person by the time you pay national and state fees. And there's not a ton of providers in West Virginia, but as far as a little bit that you could reduce a barrier to entry and a barrier to maintaining that certification, I think that's something that's super easy to do and super easy to do now. On my talking point a minute ago about the state office, as that state office gets up and running, one of the pieces that I think that not just the West Virginia Office of EMS, but a lot of EMS offices need to get in, or excuse me, a lot of state offices need to get into, is that you're in the business of dealing with people. And I think that making sure that you have the folks to interact with these folks, their biggest job is to get information out. These small EMS agencies around the state that are overseeing and making sure that they're keeping their constituents covered, they need to make sure that they shouldn't have to go dig and try to find information and navigate state law. Those types of things should be laid out for them. And when the state gets their software system up and running, back in the day, a lot of us probably think that we have people in there processing cards and doing that type of thing. What we need now are people to operate the software. You all have bought a really great software program to do the licensing and certification and the data collection in West Virginia, but it takes a while to get that thing up and running. And when it is, you're going to see great things out of it. But we need people to process someone to actually collect the EMS data on one side, also collect the licensure certification data on the other, and then be able to turn that into the reports that you all want in all of your committees and the legislatures and all that type of thing. almost done. MSAC, right now that's a very big and unwieldy board. It's got a whole lot of folks. Attendance is not real great on that. So as we start to look at that, getting that pared down to where we can be a little more nimble with getting the folks on there, getting them participating and helping them pass the things that EMS needs to pass. Initiate a state group purchasing if it's possible. We do a lot of state bid things for a lot of things. If there was a way for EMS to somehow, regardless of model, be able to get into that or figure out a way that agencies that provide EMS services in West Virginia to be able to participate in that somehow would be fantastic. As resources become more scarce, not every ambulance needs, I think a lot of times, especially those of us that have been around for a long time, every time the call drops for a 911 call, we send an ambulance and we think they're going to come in lights and sirens and ready to rock and roll. As care is progressing and as care is advancing, not every patient needs a lights and sirens ambulance with a fully staffed paramedic on it right now. And as resources dwindle, sometimes you have to think about how the application of those resources fit. So priority medical dispatch systems do things like make sure that the right care gets to the patient in a timely manner, so that the patient that collapses, that's having a heart attack, gets that ALS ambulance. And maybe someone over here that has a hurt toe, maybe it does take a few minutes longer to get to them, but that's okay because your life-saving resources are where they're needed. And then I think the last piece, which I didn't actually put on here, was, and I don't know the specifics of this because I didn't have a chance to research it before this, but apparently I think we were told that there's not a mechanism right now for the public display or notification of when people's EMS licenses and credentials are revoked or suspended or whatever else. So the state doesn't necessarily share that information. I know a lot of states do. I can look on other websites and say they're restricted or they're currently whatever else. Right now, I was told that the DHHR said that they need legislation to do that. I apologize that I didn't have time to research that. I literally found out about that yesterday afternoon, and I had time to dig into that. So moving forward, the role of the EMS provider will continue to expand. One of the things that we all have, I think we've thought about for a long time, is that the EMS providers show up and deal with emergencies, and that is absolutely still the case. However, EMS providers, especially those now that are at the tip of the spear, are dealing with a lot of social determinants of health, a lot of families in crisis, mental health, substance abuse issues, and it's becoming a big strain. And they are the leading edge of the healthcare system, and I think that we have to remember that that's going to continue to expand in our overall healthcare model. More treatment is coming out of the hospital into the field, which is a good thing for especially those life-saving things that need to happen out in the field, which is really great. As we continue to evolve, you're going to see EMS and some of that stuff with MSAC and other things that we can get established is that maybe not everybody needs to go to a hospital. Maybe they can go to an urgent care. Maybe they don't need to go to a hospital. They can go to a mental health clinic. Maybe they don't need to go to a hospital. They can go someplace else. Maybe they can go to their primary care physician if we've got a good system in place. So I think those are all things down the road that we can work on. And we have to remember too that this is a very dangerous business. We've had, I had one of my providers get stabbed in the last 12 months. I'm sure you all saw that in the news. And the impacts of that in this crazy world is that the physical stuff heals really, really quickly. But you know that the impact on that individual, the impact on our agency, and the impact on our community is still being felt, and we're still working through that. So keep that in the mind as you work to build your systems and to build the systems around West Virginia and your counties. And with that, Chairman, I'll take any questions. Thank you all.
Do we have any questions of our guest? Hearing none at this time. Oh, yeah.
Yes, sir.
Turn your mic on.
Oh,
I got it. I got you.
Just a couple. You said that you felt that as we go out in the field, we're going to do more work out into the field. Do you think that maybe we should emphasize getting more people out in the field before we start moving up their training? For instance, you said we'll bring life-saving skills into the field.
Mhm.
EMTs, they can do anaphylaxis.
Correct.
EMTs can defibrillate.
Mhm.
EMTs can use their breathing, they can put a King airway or whichever
Correct. Yes,
airways,
sir.
So what I'm getting at, wouldn't it be more profitable for West Virginia, since we are the #1 rural state in the United States, to push more, not highly skilled, but medium skilled or even lower skilled, to where we load and transport to a skilled facility?
To a point, I think that, yes, I do think that we definitely need to get more people in the system, but I do think the quality of care that we're providing at the directly with the patient needs to be a part of that. There are, I guess some of the things that I'm talking about is that progressive systems are getting into things like we're bringing ultrasound out into the field. We're bringing heart-lung machines out into the field. There's things there's places where stroke care is coming out to the field, which is the stuff that really truly saves lives. But to your point, the EMTs are the backbone of EMS in West Virginia and around the nation. And should we get more people into that? Absolutely. Should they be trained to that level? Absolutely. But I don't think we should stop progress necessarily. I don't see why we can't do both.
I don't want to stop any progress.
Mhm.
I want to emphasize
Yes, sir.
a different perspective. I want to go more out in the field. The more we lose ambulance squads all across our state,
Mm-hmm.
the longer that time is.
Mm-hmm.
Well, if we can get an EMT to someone in 15 minutes and get them to the hospital within 45, a lot better than waiting 45 for a medic to get there.
Oh, absolutely. Now, and to your point though, also to that one last slide of that, part of our progression in medicine is that hopefully we can start to work towards not everything needs to go to the hospital. And some of that does need higher level of thinking, because I would much rather not overwhelm the emergency departments, but if that person's having a mental health crisis and we can take them to a mental health clinic or mental health resource, like that's a better place for that patient to end up. And maybe that does take an extra 10 or 15 minutes, but instead of getting them into the emergency department, which is already overloaded.
But then we're getting into diagnosing, and
Mhm.
so that creates a way higher scale of training. And
Yes and no.
that's in West Virginia. I just give it some thought
Yes,
about,
sir.
I want to get more ambulances throughout our communities or
Absolutely.
some way. For instance, a defibrillator is the only thing that's going to save someone in VFib.
Correct.
And
And good CPR.
and good CPR, but CPR is only going to be good for 15 minutes.
Mhm.
But a defibrillator within that 15 minutes may revive that person.
Correct.
A full-scale ER group, there in 30 minutes, that person's still going to die.
Correct. Yeah, absolutely. Good, excellent, high quality, basic life support care provided by first responders and EMTs, especially in life-threatening situations. Absolutely is a fantastic goal to move towards. And I think to your point, getting more folks into the system is an absolute great first step.
Okay, I've got others, but I don't want to take everybody.
That's
I'll
okay.
drop it.
Yes, sir. Or I'm sorry.
Senator Stalling?
Thank you, Mr. Chairman. Again, we hear about crisis modes and stuff in lots of different arenas.
Yes, sir.
And the third slide, EMS is in crisis. And again, I've been contacted by people that I know and trust and truly believe that it is in crisis. And so can you somehow describe to what degree it's in crisis? And again, I know we're here in Morgantown.
Yes, sir.
And we talked about even a EMS closure right around here, but we're also a very rural state and a fairly poor state.
Mm-hmm.
So can you give me some idea and give the people, the public, some idea of just what type of crisis we're in?
I'm gonna tie into Delegate Jennings' position there a second ago, that I think that EMS of the systems that I came up in, and probably a lot of the ones that you're familiar with, it was a system that there was a natural affinity towards it. And I think that we did have a bunch of volunteers, which, like I said, I came up as a volunteer, and a lot of folks that were supporting their communities. And I think that one of the biggest things is getting folks involved in that. Now it's become more of a career, and there are more folks that are, that are getting paid to do it. But now I think that the actual job itself has changed. So whether you're providing it volunteer or as a career provider, that you're back on that one slide, you're dealing with tons of mental health issues. In the last 2 years, if you're a volunteer, I know of providers that decided to stop volunteering because they didn't want to come out, potentially get exposed to COVID and then take it back home to their families. And it has been, if you think about, I'm gonna dedicate X number of hours to my local community, and I've got to come in and now I got to get in gowns and respirators and all that type of fun stuff for 8 hours and deal with the sickest of the sick. There's probably not a huge attractiveness to that for a lot of things. And then when we do even switch over to the career folks, and I know there's a little bit of a divide, but we're not necessarily paying these folks the levels to get them in there. If you can go and work at a local retail establishment, if I can go to, one of the signs, for a local retail hardware store in town is paying $17, $18, $19, $20 an hour. When I post a job for an EMT for 16, they close at 6 o'clock or 7 o'clock. We're open 24 hours a day. So I think that we have to continue to build a culture that to get folks into the industry, find ways to get them in, keep them in, promote them, make them an arm of healthcare, and make it more of a career lifestyle, or if you're going to do it for volunteer, do it for volunteer to get folks in. To your other point of, as far as the crisis, there's not necessarily a silver bullet. Staffing is absolutely one, but then that impacts everything down the path. I know those of you folks that live in Charleston deal with a lot of wait times as far as getting ambulances offloaded. Up here, we don't have enough ambulance. We're insulated slightly because I'm in a big area, but Delegate Sadler can tell you, there are times in Mon County that the only ambulance that we have is in Blacksville. Well, if you collapse here, the ambulance in Blacksville doesn't help you. I can say, yes, sir, I do have an ambulance available in my county, and it's on the way. It's 40 minutes away because it's coming from the high school, but that's in the rural area of the county. And we're a little bit insulated, but I know that there are places in this state that don't have that luxury right now. And I think it's a multifaceted approach of getting folks in, looking at other systems of care, whether that if there's mergers, acquisitions, regionalization, partnerships, whatever that might be. I think all of those things can all be discussed in different levels to try to find ways to solve the problem.
Yeah, again, I think that you all do such a good job. Again, sacrifice, double back, all the things that you do to try to provide, because it's in your blood, to provide that emergency care.
Yes, sir.
That the general public hasn't felt the crisis in general, because, you do it with half the staff, you do it with, so sometimes you're your own worst enemy as far as, but that bow will break at some point.
That's correct. And I think that's a really good point, because I think we get it double here, because I think West Virginians are also very hardy people. Everyone in this room, we all buck up if there's floods or there's a big need. Everybody just goes and solves the problem and we move on with our lives. That doesn't necessarily happen around the U.S. And I think that EMS providers do that same thing. And to your point, we are good at patching stuff together, and we're getting through today's crisis and then moving on. And to your point, absolutely, I think that the public has absolutely been insulated with some of our stresses.
Any further questions? If not, I'm sure Forrest will be around for a while to talk to us. As you can tell from his presentation, we are in crisis. I don't think there's any doubt about it. We're losing services around the state, and we do have that number, but I don't have it here with me tonight. But we have got to buckle down as a committee in the upcoming session, and we've got a lot of questions to be answered. He gave us several on there that we need to work on, but that's only a few. We have a quorum now, so we will go back to the third item of business for, I'd call on a motion for the approval of the minutes. Chair recognizes the co-chair.
Thank you, Mr. Chairman. I would move approval of the minutes of January 11th, 2022 be approved as written.
Is there any discussion? Hearing none, all those in favor of the approval of the minutes, say aye. All opposed, same sign. Motion carried. Next we have is going to be item 5, presentation discussion on HCR 109. I would have to apologize to the committee. We've had some things come up that is relevant to this, and I've asked some guests to come in to speak on this that I don't have on the agenda. But with the committee's indulgence, I would like to do that. And I know we're going to ask our attorney to come up and to explain what House current Resolution 109 is. And I also would ask that Vice Chairman Delegate Riley be able to come forward and talk to us. He's the lead sponsor on this bill. And we had some things in mind that we wanted to do and look at. And I would also tell you that through some funding sources that we have, we was able to put some funding in our county here, MTech Center, and the principal, Greg Dosh, is here. I asked that he would be able to speak for a few moments today because it's relevant to what we're talking about and asking 109 to do. So I would ask first, if it's all right, if we allow, Clay, do you want to speak first? Because I know you had a commitment. Okay. So, Daniel.
Thank you, Mr. Chairman. For those of you who don't know me, I'm Brian Casto, counsel of the committee. And as the chairman stated, we are looking at HCR 109, which did not come before this committee at first as a study resolution, but was presented as a study resolution for the Joint Committee on Education and Joint Committee on Health, asking those committees to study the cause and possible solutions to issues surrounding the supply of and current demand for future emergency service personnel. The resolution states very simply that the legislature recognizes what has been amply spoken to today by Mr. Wyam, which is that there is a workforce shortage of EMTs and paramedics in West Virginia. The COVID-19 pandemic has only exacerbated those longstanding trends, and that we need to do, as was spoken to earlier, address these in a systemic fashion. And that the best way to do this is to plan initiatives now while we have the opportunity to meet future anticipated needs and determine the state of the workforce by doing a comprehensive study of what the current supply of trained EMTs and other personnel is, and what we anticipate that the future demand is likely to be, given the fact that we have, quite frankly, a population that is demographically aging, and thus we can anticipate some higher needs. The request was made that the Joint Committee on Education and Joint Committee on Health jointly study the cause and possible solutions to that issue, and that the study would, as one of its features, include a request that various components of our educational system, particularly the higher education system, such as HEPC, the Community and Technical College System, DOE, and the Department of Health and Human Resources Office of Emergency Services, study these issues as well, including not only the supply and demand issues, which can be economically forecast and kind of actuarially forecast, but also look at what they have vis-a-vis current state opportunities for training, whether those are adequate to the anticipated future needs, how many current enrollees we have, the number of anticipated graduates that we have in the future years, what the current barriers are that are keeping those education programs from being expanded if there is a need to expand them to meet those anticipated demands, as well as what the likely industry conditions for employment are, and if there are barriers to workplace entry that we're unaware of, such as have been brought up here in terms of barriers to entry, both for EMS services as well as for individuals, barriers to entry, such as the abilities to obtain both the initial and ongoing training, current salaries in the field, et cetera. The request would be made by the resolution that HEPC and the Community and Technical College System compile these findings and provide these to the committee with a list of possible solutions, and that the Committee on Education and Health both report to the regular session with the findings and with the customary language on appropriations to cover the expenses of those reports. Members of the committee, that is what the resolution propounds.
Delegate Rowley, would you like to give your presentation now?
Yeah, thank you. So good afternoon, everybody. This resolution came to us, this was my first year on the Committee on Volunteer Fire and EMS. And it came about as we began to dig into some of the issues and continued to talk on issues in the past that this committee has worked on, such as lowering the barriers, continuing to try to provide educational opportunities. The reason that we ended up putting that into a joint committee, or recommending that at a joint committee of education and health, was we felt that there are each unique aspects of how the Career and Technical College, who currently provide that, and have identified some barriers to the training that they are seeing in some cost, as well as we are hearing on the reimbursement rate from the health side, as well as the increasing need to increase wages. So as it's truly part of the healthcare system, we felt that a joint presentation, a joint study of that workforce issue to be able to adequately provide the supply, as well as sustain it long-term with the financing and the funding that is needed through the healthcare system, because I think they do work hand in hand. So essentially, I mean, Attorney Castro gave a pretty good description of it, but that was the idea behind the resolution and why it went through those two joint committees. So obviously we've been working on a lot of other issues, but that's specific to the resolution.
And I appreciate both of your explanation of what we're trying to accomplish with this resolution. And with that, I would ask Greg Dulch to come forward. And I believe I said principal, but I believe you're the director of MTech. If I've misquoted your title, be sure. But it's I think it's very important you hear this, because the educational component of this, we were able to pull out some money and get it to come into Montague County. He contacted me early on. We talked about the crisis. He says, I believe I have part of the solution to the problem if we can do some funding, and I'll let him explain his whole thing. But I will tell you all, if your mind is not blown, because we all hear how we can't get anybody to go in for training for EMTs, paramedics, that type of thing, it can be done. And he set up a situation and a look ahead that we as a committee, I think we need to look at this and analyze how this was accomplished. Greg?
Thanks, sir. Good afternoon, everybody. And again, welcome to Morgantown. Housemember Statler brought an opportunity to the Montague County Technical Education Center to get funding through the Governor's Emergency Management Service Initiative. So what we did was we applied for a grant through this initiative. We received that grant, and with that grant money, we worked with, and we are working with, Shirley M. Kimball Training Facility through WVU to offer EMS courses in the evening, 2 separate sessions, free of cost for those that sign up. So June 6th, we'll be beginning our first session, and our second session will begin on September 8th. So they're going to be about 3-month sessions where we're going to service 50 of our 100 applicants. So kind of backtrack just a little bit. We put this online through social media that we at MTech would be offering a free EMT course for individuals that would sign up. This would be free of cost, which would include their uniforms, their curriculum, any consumables. Shirley M. Kimball is going to provide the ride along and all the teaching for this course. We put it on Friday around lunchtime, the link on social media. By Monday morning, we had over 100 individuals sign up for this course. So we had to sift through our applicants, and we have determined that we will be able to serve 25 on both separate sessions, so 50 overall. We also took some of the funding from this grant opportunity, and we're going to start a continual high school EMS program through the State of Education CTE office. This will be another one of our course offerings for high school students starting in the fall. It's a 2-year course where the students, once they've completed that course, they'll have the opportunity to take their examination and leave high school with not only a high school diploma, an MTech certificate, but also licensure to be a certified EMT or EMS. So that's what we're doing with the grant monies. If any of your areas technical education centers would like to reach out to look at the budget that we proposed and was accepted by this grant opportunity, feel free to do so, because we're here to help as best we can, not just this area, but the state itself. So I'll gladly take any questions if you have any. Yes, sir.
Shirley Kimball going to be the instructors?
Yes. Yeah, essentially, they're going to take care of all of the evening offerings. It's going to be 2 evenings a week and then an occasional Saturday, 180 hours from our first session runs from June 6th to September 17th. Then our second session overlaps for a week or so, September 8th to December 17th. So Shirley M. Kimball is going to be taking care of all of it. We just put it out there for them, and they're going to be utilizing our facility to hold the classes in the evening and on the weekends.
Any additional questions? Please stick around. There'll be some come up, I'm sure, as we go, because as we dig into this, you know, we just opened up a little bit of that can of the worms when we talk about that funding. And part of that's that $10 million that the governor set aside and made available. And between Senate and the House, we looked at several ways that this money could be expended. And we talked back and forth. Do we give it out to the squads? Is that the best use? How do you do it? And so we came up with a plan that we feel will help the most. And one of the areas was training and retention. And for him to get those numbers that quickly, I think within the first hour, I'm seeing there was 27 people had already made an inquiry wanting to look at it within an hour on social media put out there. That was before the formal launch of it all the way out there. So it truly got its wings and got started. I'm ecstatic that it was able to done. And if it can be done here, it can be done everywhere. I would ask Delegate Riley, Vice Chairman Riley, if he would explain a little bit about that 10 million, where it's at. I know he's been keeping track of. For those that don't know, he may be my vice chairman, but he's my right arm. I will tell you, I could go out there and look at these pie in the sky problems, and he's the guy that digs up the information and analyzes everything. That's the engineering coming out in him, and I'm thankful for him. So Delegate Riley, if you would.
Yeah, so as part of that CARES money that was allocated, one of the things that we continued to hear was about the training costs and the ability to have training in remote areas. We know in the Eastern Panhandle, it was specific that while they could get students for the classroom, but the hands-on training. So as part of that proposal, there are some mock-up trucks that are in process that will be available to all the I think there are 5 trucks to the career and technical community colleges, as well as available to squads to where they can travel to each squad location on request to be able to provide some of the continuing recertification, some of the education, and some of the basic training. So whether they have a wide variety of software that is loaded onto these trucks, as well as different types of mannequins for them to be able to perform their training. So that's part of that, and that's part of that $10 million. In addition, I think you just heard where some of the other funds are going to be able to provide that budget. I know there are some other squads that are looking to apply for training to cover that cost to be able to increase that number. So that's the genesis of where those funds are going.
And we did turn that mainly the control over to the career or the community and technical colleges, because some of the limitations on that money is it must be spent by the 30th of September. While I'm not a big advocate of just spending money to be spending it, if there is true needs out there that we have and we can do that, we got a time frame that we've got to work with. And I know if I'm correct, I think I'm correct, we have 6 community colleges now that offers the EMT training, and 1 was coming online. I'm not sure where that one's at this process. I do know that some of that money was available for equipment. I don't know if the MTech had put in for any of that, but there is money available also if you would need some training equipment and stuff that's out there. Hence, that's why we got the 5 mobile labs on order. And these are just souped up ambulances that can go out into the fields. They can be here a week. They can come in to MTech scheduled ahead of time. One of them can be here. Next week can be over on the Eastern Panhandle and the Northern Panhandle, southern part. But since there's 5 of them, we should be able to manage these quite well and get them out there. We felt that was going to help the training and be great into that area. So again, I really thank the Senate. I thank the governor first for making the money available. And yes, Delegate Riley.
The other thing I was going to say, I believe they are scheduled to be in Charleston for one of our interims, so either June or August. They're looking at when they can have either the sample or the full truck there for us to be able to evaluate it. So that is going to be made available. I think it's August is when they're scheduled to be here.
I appreciate that. I will be looking forward to seeing that out there. Any other questions of any of presenters or ideas where you think we should go? This is what we love about these interims. It is a joint committee that we can sit down. I personally, this is just my personal feeling, is we have to make some commitments in the session coming up that we've got to get out there. We got to help these organizations that's out there. As we've heard today, we have a new director coming online. We have a new system that's been out there. It's been out about a year. Unfortunately, it had some problems that wasn't getting rectified. They did bring the company in. Vice Chairman Riley and I was able to speak to the director and also acting director at the time, and to Secretary Crouch of the DHHR. I will tell you, they made quite a statement to us that it would be taken care of. The CEO of the company was getting personally involved because things were happening that they didn't have an explanation for. So to the squads, I hope they're starting to work a little bit better, and I know there's a long way to go to get them to work the way they want. And that is what we directed Secretary Crouch that we wanted to happen. Yes, Delegate Riley.
One thing related to image trend, the payment portal, which was a major issue, which was not included in the original scope, is set to go live June 29th. So that'll help the EMS with being able to make those payments. The other thing is they have a full training coming in. We had I think it was a questionable rollout. They have a full training of all the OEMS staff on June 13th. So there's 3 full days of training to make sure that operationally they know how to utilize the system for the EMSs. So just an update on that.
I appreciate that update. And as I said, we are to continue to work on this. We are hearing the cries from the field. We're hearing the people that's having problems trying to get recertified, their EMTs, their paramedics. We're hearing that cry. We've got to solve those problems. Those are problems that should be able to be taken care of with this system. It's problems that I saw, I believe, on social media. A gentleman here locally had tried for 2 to 3 months to get recertified as an EMT and was unable to do so because of the systems and going through it. So we're continuing to work on those problems and will continue to work on them as we see them coming forward. We're giving you an update on the 10 million best we can. I asked Vice Chairman Riley, and I don't know because it was late. It was yesterday afternoon. We were talking and I said, you know what? We need to talk to Dr. Pursley and ask her if we can get an update on where we're at with that 10 million and the budget. And I know that was a heavy lift if he could accomplish that. So I would apologize to the committee. I had planned on having that, but I waited too late. Even my guru of numbers, he's got some time constraints that he couldn't overcome. So is there any other questions? Yes, sir. Senator Stallings.
Magic. Okay. Thank you, Mr. Chairman. And again, something that we might be able to fix sooner rather than later. And I know this is going to take a little time, and thank goodness we're trying to come up with a multifaceted fix on this. But one of the things that I was deeply disappointed in this last session, and I think it had huge support from everyone, and it has to do with our volunteer firemen and the increasing the fee on insurance that would actually help these volunteer firemen. So with this committee, having studied that a long time, I would hope that we would put our shoulders behind getting that on a special call, on a special session, the next one we have, whether it's June or whatever. And let's get that thing rolled out. I think that, again, it had huge support from both houses, the best I could understand. And I don't know whether it got, we were trying to amend another bill into it or something, and it might have messed us up there at the end. But let's run that bill clean, and let's help out the volunteer firemen funding as well. I urge this committee to put its shoulder behind that.
Well, as you know, in the last interim studies we brought that forward. That was one of the things that we had looked at. And I could tell you personally, I had made the statements that although I know the volunteer fire companies also needs funding, the EMS needs funding also. And the one thing that we had looked at possibility of working out an arrangement. I know my vice chairman had looked at some numbers, and we tried to work through to see where's the happy medium. Could we get some of that money out of there for the EMS services? And I will share with you that I'm willing to move forward. I would ask our lead attorney to convey across, if that's okay with the committee, to convey across to the governor that we would like to see that put into a special session. And I'm sure that there will be one in June. You know as well as I do that that's probably going to happen. Yes, sir, Delegate.
I'll be willing to push that, but like you said, EMS has got to be a part of it. It can't be straight fire. There's no other place we can get money for EMS. And that's a fitting thing. The EMS backs up the fire, and it should be on there with it.
What we'll do, since this was not on the agenda today, if it's okay with everyone, we're going to put that on our June interim session to look at in June. Everybody start thinking. We can all talk to each other, talk to our local areas. It's not anything surprising out there, I don't think, to the fire, because I talked to them several times in session saying that if it comes forward, and yes, Senator Stallings, I would say that the amendment that was tried to be placed on that drug it down did not help it any, especially it was really out there. So that saying, if it's all right, the committee, yes, sir.
One question. My name's Chad Lindsay. I've worn several hats throughout the state. One of them is in the State Firemen's Association. So are we referring to the bill that never come out of the Finance Committee on the House side? Is that what we're talking about?
Yes.
Okay, so we're planning on trying to get it out then. That would be great. I mean, we were told, and of course, you know how you were told things go. And, we were told the reason that didn't come out is because we weren't a high enough priority. Which I found that very hard to believe, especially with conversations we're having here today. But, I sit on the MSAC board as well, and I wholeheartedly agree EMS needs money, fire needs money. The volunteer system in West Virginia is dying if we don't get on board.
I'm going to have to ask that, according to the rules, guests cannot speak during the committee or the interim meetings. We will talk to you after with you and anybody that wants to. And I appreciate your statements and what you're saying. Any other remarks or questions from the committee? Hearing none, I will say to you that a couple items that I think in housekeeping. One, if you have any questions or anything about the area or what's going to go on, the CVB is set up downstairs in the lobby. They can direct you to wherever you want to go. I believe that the tours that's set up, they can work with you on that, talking to you about it. The one thing that I want to bring to your attention is that the county commission, along with WVU, we are having a reception. There's a reception tonight at President Gee's home, but tomorrow night we have one at Monum Park. And you won't see much of me tomorrow because I'm going to be up there roasting the hogs. So I certainly want to extend the invitation to everybody to attend and come up there. We're going to have some, we want to showcase Montague County. We want to show you what we've got here and where we're coming from. So with that, if there's nothing else, and please, as our guest, if you got questions, avail yourself to talking those. I would turn to our co-chair for a motion.
Thank you, Mr. Chairman. I would move we adjourn.
Motion adjourned. Any discussion? None? All those in favor say aye.
Aye.